Hi, everybody, and welcome to episode 74 of the Pet Behavior Chat. So I thought I would do this episode on how to administer medications. And this is really part of sort of a little series that I'm starting, which is all to do with medication. And of course, we're going to be talking about behavior medications, psychopharmaceuticals, because that's one of my areas of extremely special interest. So we're definitely going to have a few episodes around this topic over the next sort of couple of months. And I thought, what better way to start it by actually talking about how we give medication to our pets. So this is nothing to do with which medications we're choosing or in which situations, medication might be indicated. This is literally about how do we get medication into our pets, because that's a huge piece of the puzzle if we're even thinking about, whether medications are an option. And of course, this is not just for behavior medications. We've got many, many pets that are on long-term medications, whether that's perhaps for an endocrine disorder or maybe a skin disorder or anything like that that requires kind of ongoing care, chronic pain, arthritis, anything like that, that may require ongoing medication. And then, of course, we have just kind of our routine pet care medications. So our dewormers, potentially flea and tick treatment, although there are different sort of administration options for many of those. But giving any kind of medication by mouth, especially, is something that can be quite tricky, especially for cats, but also some dogs. I've seen a number of dogs where actually getting medications into the dogs has been a real challenge. And this is so frustrating, especially if we know that they really could benefit from a health point of view from those medications. And perhaps if we don't have other alternatives in the way of the formulation, whether there's a spot on or if there's no spot on or other kind injectable for a format or something like that of the medication, if we're really relying on oral medications and we're really struggling to get those into our pets. And then I also know some pets who struggle with other modes of medication administration. So I know a number of cats that don't love having a spot on applied between their shoulder blades. So it's something that I think we need to consider for each individual, as an individual personality, if you like. But in this episode, I'm going to be focusing on oral medication administration, because that's what we see most commonly. And certainly that's, the most common mode of administration for our behavior medications. So I'm going to give you my top 10 tips, and I'm going to try and get the numbering right this time. So I'm going to give you my top 10 tips on how to give oral medication to our pets. And hopefully that'll give you a number of different ideas and suggestions if you are struggling, if that's something that you're struggling with your pet. All right, without further ado, let's get to it. So number one is we want to try and avoid force pilling them. Now, this is a bit of a tricky topic because sometimes we just need to get the meds into them. And, perhaps force pilling is a way of doing that. However, we never want to be, rough or heavy-handed with our pets. We certainly never want to be so rough that we're inflicting any kind of pain or excessive restraint on them. And if we're thinking, for example, about behavior medications, the whole idea of our treatment plan is to reduce stress. So if we're going to introduce something on a daily basis that's going to increase stress levels and put a strain on the relationship between the pet and the caregiver, then that's probably not going to be beneficial in the long run. And again, if we're administering medications maybe once every 3 months for worm control, then, maybe a one-off kind of force pilling event is something that we could potentially kind of think that the pet is going to tolerate. But if we're giving medications on a daily basis or even a weekly basis or even just a couple of times a week, then force pilling is not something that we want to be thinking about as a long-term strategy or solution. So again, it's thinking about, the relationship, preserving the relationship between the pet and the caregiver. So many animals are fantastic at associating things. So the moment they potentially see you coming, after a few times of force pilling them, then every time they see you coming, they're unsure about what you might do. And there is potentially a negative association. The cat might kind of zoom off under the sofa, especially if you've maybe been to the cupboard where the medication is kept and then you approach the cat. So remember how good pets are at learning associations and at learning about things that make them uncomfortable. So there's that learning process in there as well. So that would be my first tip, is avoid force pilling, especially if we're talking about long-term medication. In particular, if we're talking about behavior medications, but I would argue for all long-term medications, because if we're trying to create a better overall quality of life, welfare, wellness, if we're looking at reducing stress levels, then introducing a daily stressor, that is force pilling, is not going to be helpful at all. So that's my first thing. The second tip is avoiding pill poppers. Now, pill poppers, just to explain, are kind of long plastic devices with perhaps a rubber tip at the end, into which you can put a pill or a tablet and then insert it into the pet's throat. Oftentimes these are used for cats, but I have seen pill poppers used for dogs as well, especially small breed dogs, if people are struggling to administer pills to small dogs. And I have a real issue with pill poppers, and there are a few reasons for this. Number one is I have seen a couple of foreign body surgeries that needed to be performed after a pill popper was used. So the rubber tip came off the end of the pill popper and got lodged either in the pet's esophagus or made its way down into their stomach, but then no further. And the pet needed to undergo emergency surgery in order to get that foreign body out. So that's the first thing. The second thing is, if we're thinking of using a pill popper, we're probably thinking that it's going to be kind of like a really fast, quickly get the pill popper down, shoot the pill down, and it's going to be a quick thing and over and done with. And I think that predisposes to using perhaps speed, maybe excessive force, maybe kind of going in there with this sort of approach of, right, we're just going to get it done. And that can potentially inflict injury to the pet. Now, if we think about the pill popper, if we think where it's going to go, it's actually going to go into the very, very delicate structures that are, in the throat area. And there are a number of different things that could potentially be damaged or, abrasion caused to the inside of the throat. So I just feel really strongly that this is a method that we don't necessarily have a lot of control over. It's really difficult to gauge accurately where we're, placing the pill. Then there is also the place in the throat where the esophagus goes one way and the airway is there as well. And the airway, yes, is protected by the epiglottis. However, again, if we're in this sort of state of frenzy and we're giving it really quickly, God forbid the tablet should go down the wrong kind of bit and actually get aspirated into the airway. So there are a few things why I personally very much dislike pill poppers. I know other professionals use them. I'm sure a number of other vets would disagree with me. Perhaps some caregivers might disagree. That they've been using pill poppers on their pets or with their pets for their pets successfully. But in my personal experience, it's not something I love, and it's something that I always warn against. And I think maybe that comes with time and experience and just having seen things go wrong, far too often. So those are my kind of two, let's try and avoid these. Let's try and avoid force pilling, and let's try and avoid pill poppers if we can. Number 3, make it fun and use something super high value. So when we're giving a treat, especially if we're hiding it in something really high value, such as a piece of meat or maybe some peanut butter or maybe some soft cheese or, maybe a piece of fish or whatever it is that your pet finds super high value. And especially for dogs, we want to get really excited about it, make it fun, make it something, super sort of exciting. And oftentimes the dogs in particular won't even notice that there was a pill inside that yummy high value treat. With cats, that can be a little bit trickier because we can't usually get them kind of excited and a little bit buzzed up. And it can sometimes also be more difficult to get a high value treat that's perhaps big enough to kind of mask the tablet inside there. But for dogs, for sure, we want to, make it fun, use something really high value. you might need to spend a little bit of time finding out what that high value thing is for your particular pet. So for some dogs, it might be hot dogs. Other dogs, like I say, might be absolutely in love with peanut butter or cheese or fish. Some dogs, my dog Lexi loves it in a cat creamy treat. She absolutely dies for those cat creamy treats. So, putting some medication in there would probably be something that she would just lap up because it's so tasty and so high value for her. So think about that, experiment a little bit with what it is that your pet loves, and make it fun and use something very, very high value. Number 4 is use the 3 meatball trick. Now, meatball doesn't have to be meatballs. It can be 3 little bits of fish, or it can be 3 bits of cheese. But the idea with this is that we don't want our pets to associate getting something high value and there always being medication in there, because they might start to kind of suss that out and build those associations. And then all of a sudden, if you're coming with a high value treat, they're like, yep, I know what you're up to. And all of a sudden that high value treat loses its high value. So with this kind of 3 meatball trick, we give 1 treat, high value treat without the medication inside, or maybe even 2. Then we sneak 1 in there that has the medication in it. And then we follow it up with a chaser. So with maybe 1 or maybe even 2 high value treats without the medication in there. And we want to also think about potentially giving the high value treat at very few other points in time throughout the day, so that we're not always associating the high value treat with medication. But again, you can make this super fun. You can kind of, even if your dog catches from the air, you can throw a little meatball, throw the third one that maybe has then the medication in it, and then throw a couple afterwards. So, the dog's not focusing on the taste or whatever might be in that meatball, but rather is focusing on the activity of receiving more treats. And that brings me nicely on to my next point, which is point number 5, and that is masking the taste of tablets. So oftentimes medication can have quite a bitter taste, especially if it's not a veterinary formulated medication. So if it's maybe a human medication that we're using for our pets, they can have kind of bitter, sort of medication-y tasting flavor to them, or they can just taste a little bit bitter or not very pleasant. And there are a couple of ways that we have of masking those tastes. Now, the first one is commercially available things such as pill pockets, or you can get putty that you can make a little pill pocket from. And these pill pockets are they're a little bit, like putty. So they're kind of formable and malleable. They're soft and squishy. The pill pockets kind of have a pre-formed little pocket inside already. And the substance, or the putty that they're made of, is very intense in flavor. And you can pop the pill inside and you can kind of squish the putty around the pill and give it as a high value treat. So pill pockets or pill putty, they're available in many different shapes and sizes. I personally really love the Greenies pill pockets. So they're really, really, really kind of tasty, and they come in a couple of different flavors. I think they come in chicken and salmon and a few other flavors. So pill pockets are great. The other thing that's really great for masking these bitter tastes are dairy products. So that could be a little bit of cream cheese, or a little bit of cube cheese, where you kind of make a little hole and put the pill inside. You could think about butter. You could think about whipped cream. You could think about, potentially milk, although that's probably a little bit too liquidy in its texture. But dairy is really great at masking bitterness. That's why we put milk in our coffee, right? Because we want to take that edge of bitterness off the coffee. So using a dairy product, obviously we don't want to use masses, because especially we know cats are, sensitive to lactose in dairy products. But I know a number of cats that will give their right arm for a little bit of butter. And if you can then kind of wrap the medication in a little bit of butter or a little bit of whipped cream. That's a good one as well, like the squirty cream that you can get. I know a number of cats where we've been successful with those methods. And the same for dogs. I know one of my sister's dogs would only take medication in cheese. And that's probably because he loved cheese, but I wonder whether there was some kind of masking element as well, to the sort of the smell or potentially the taste of the medications. And remember how good our dogs and cats are at smelling. So that's an added disadvantage for us, is that they're likely able to smell things before they taste them. So that's masking the taste. The next one is we are going to use play. So a little bit what I said earlier about, making a kind of a playful sort of event out of it and tossing treats. And if your dog's really good at catching things out of the air, using play for that. Another way of using play could be by using a food puzzle toy, for example, and getting the dog really interested in the food puzzle toy and having one of the elements there containing the medication. So play is always good. So in point number 3, I said make it fun and high value. So this is a little bit part of that, but really using play. And with cats, you could really kind of play with your cat, get them really excited until you get to that point where they want to like pounce on the thing and then kind of potentially consume it. So you could get them really excited and playful, and then potentially, introduce something that contains the medication. Now, this isn't going to work for every individual, but we know that some dogs and cats in particular are highly, highly play motivated, and where actually toys or play are more valuable maybe than food items. So introducing the play, or even then using play as a reinforcer or a reward after they've taken the medication. So play can be a really good thing to add in. Okay, point number 7 is use hunger. That's really obvious, but when your pet is really hungry, they're going to be more likely to want to take a treat. And if that treat then happens to contain the medication, then that's maybe not something that they're so focused on. So administering medication at, kind of strategic points throughout the day. So maybe first thing in the morning when they're really hungry, and maybe just giving a tiny little bit of wet food with a medication in it first, and then putting down the remainder of their food ration, perhaps for the morning. So that's something that I feel works really well with cats. So if cats are really kind of hungry and asking for food in the morning, then give them a tiny morsel of something super tasty, a creamy treat or a fishy wet food, pop the medication in there. And then once they've consumed that, then they get the rest of their breakfast, if you like. So think about the times of day strategically that your pet is going to be really, really hungry, and introduce the medication administration at that time. Point number 8 is using things to help. So, for example, there are gelatin capsules available on the market that are kind of flavorless gelatin capsules that you can open up and put medication into. Now, this is particularly useful if your pet is having more than one medication. Let's say, in the mornings, let's say in the morning, they're taking maybe 2 or 3 different medications, or at other points throughout their day, about the day, they're taking more than one medication. You can combine, let's say, 2 or 3 different tablets in one of these gelatin capsules. And the gelatin capsules are pretty flavorless. They're very inert. And then you can wrap the gelatin capsule in something yummy and something tasty. And then that's just a one-off thing that they need to swallow, rather than having to give them 3 separate medications, and each of them kind of smelling and tasting a little bit different. Some of them maybe being quite sort of aversive and bitter. So these gelatin capsules are amazing, and you can get them in different sizes for different sizes of pets. You can buy them usually online. They're really easy to find. Important is that they're flavorless, and that they're manufactured for safety, for human consumption, potentially even for pet consumption. And yeah, it's a really good way of combining specifically, numerous different medications into one administration piece. So the gelatin capsules are one. And then the other thing is asking your vet to perhaps use a compounding pharmacy. So that means getting the medication put into a different formulation. So for example, if you maybe struggle at giving tablets, it could be compounded into a liquid, for example, or the medication can be compounded into a flavored chew treat, for example. So there are many different compounding pharmacies around that can change the formulation or the way that the medication is administered, either by turning it into a liquid or turning it into a chew tablet. The only thing I'll say here is that likely transdermal applications are not going to be great. So we've got a number of studies looking at transdermal. So that's either a cream that you rub into the inside of the pet's ear, or maybe a patch that you kind of stick onto them that then gets absorbed through the skin. And there are a number of studies that are looking at the bioavailability of the medication if they've been given transdermally. And unfortunately, it's not great. So for fluoxetine, for example, if I remember this correctly, I think the transdermal application of fluoxetine actually only achieved a 10% bioavailability. So whereas we would like them to receive 100% of the drug, they were now only receiving 10% of the drug. So we have to be careful with some of the compounding formulations, if you like, and it would be really amazing if over time, we did get some medications that were available in a really good transdermal formulation. That isn't available as of yet. Certainly for behavior medications. Other medications, yes. So for cats, for example, metazapine, which is the appetite stimulant frequently used in cats, that is now available as a cream that's applied to the ear. So some medications perhaps can be given in that way. But certainly not many of our behavior medications, or any of them, if I'm being honest. But, I know of colleagues that have had fluoxetine, for example, for cats compounded into a tasty liquid, or a chew tablet for dogs. So there are other ways of kind of presenting the medication rather than sort of a bitter tasting and smelling pill. And then on to point number 9. Now, this is a little bit about learning and training. So it is actually possible to operantly condition or shape our dogs or train our dogs, for example, to follow a swallow command, or I've mentioned it a couple of times already, a catch, catching something. If you throw something for them and they catch it in the air. And now the likelihood with things like this is that the dogs potentially are going to be more focused on maybe the cue, especially if the cue is highly reinforced and the dog finds it really, really reinforcing and rewarding. Or if they're catching something out of the air, they might just catch and swallow in one go, and they kind of didn't even realize that there was a medication in there. And I know some of my colleagues have actually taught on cue swallow. So they've perhaps placed something in the dog's mouth and then given the cue swallow, and the dog has swallowed. Now, you probably need the support of a really great trainer here if that's something that you want to sort of think about. And in my experience, that's oftentimes been a last resort. So when we've had dogs where none of the other tactics or strategies have really worked, then we've perhaps thought about introducing an operantly conditioned behavior, which is usually swallow or catch from the air. And have put that on cue, and that's something that can sometimes be helpful. So like I say, it's a bit of a last resort, and something that you probably need to get a really great trainer involved with to help you teach that, but that's something that is also a possibility. And then finally, my point number 10 is ask for help. If you're really struggling to administer medication to your pet, please don't just not give it because it's too hard. There's probably a really good reason why your vet has prescribed the medication for your pet. So ask for help. It could be that there's a different formulation, or that it can be compounded, or that your vet is able to give you some strategies. It's possible that, maybe rather than using medications, things can we can use things like lifestyle changes or adjunctive treatments. So I'm thinking, for example, maybe a dog that has chronic osteoarthritis, where maybe the taking of medication is becoming difficult. Is there, for example, a monthly injection that can be given instead? Yes, there is. It's an injection called Librela that could be an alternative option. Are there lifestyle changes that can be made that will perhaps reduce that dog's need for medication? Are there other adjunctive therapies, such as, let's say, acupuncture or laser therapy or physiotherapy, hydrotherapy, that can be used instead of medication, or in order to reduce the amount of medication that pet needs to take? So ask for help, have conversations with your vets and your other pet care professionals, your other pet care providers, to see, if we can find solutions. The last thing any of us want is to give you medication that then you can't give because it's too difficult to give. And then we see that pet back, a few weeks later, and the pet is actually worse, or, you know, there hasn't been any improvement. And that's because that conversation hasn't been able to happen, or because maybe the communication hasn't been there, or maybe the caregiver was too embarrassed or too scared to ask for help. So I think those are really kind of important points when we think about managing any chronic condition. And if you have a look at some of the episodes that I've done recently, especially with Hannah and with Evie, you know, where we're actually talking about the caregiver burden on managing some of these chronic conditions, and that can include administering medications. We know that it's not an easy feat. We know that living with any pet with a chronic condition, whether that's a physical health condition or perhaps a behavioral chronic condition, we know how stressful that can be. And then obviously it can get even more stressful if, you know, if there's concern about how am I going to get these tablets into them, and how's that all going to work. So please ask for help. Reach out to, you know, your trusted pet care provider. Reach out to me if you don't have anyone else that you can feel you can perhaps discuss some of these topics with. So these are the types of things that I think really need to be talked about more, and there need to be open and honest conversations. And if your vet recommends something that you don't think is going to be practical or feasible, then you need to tell them that, so that they can come up with other potential solutions for you. So that's a little bit about getting medications into your pet. And as I said, this is kind of the first episode in a few episodes that are going to be happening over the next few weeks, interspersed with some other episodes, but we're really going to start heading down that road of medications. Now, in the show notes, I'm going to put a free PDF, a link to a free PDF that you can download, which basically has everything that I've just talked about in a downloadable sheet, something that you can pop on the fridge maybe, or just have to hand if you've maybe forgotten, or if you just want a reminder of what are all the different strategies you can use to help administer medication to your pet. So that's going to be in the show notes. And then I'm also going to put a link for my new and amazing online course, which is called Psychoactive, which is going to be all about medication, so behavior medications, psychopharmaceutical medications. Now, this course is most definitely aimed at vets and pet care professionals. However, if you're a pet parent or pet caregiver, and it's a topic that also interests you, or maybe your pet is on medication or has been on medication, or it's something that you'd like more information about, then, you know, potentially this course could also be something for you. However, it is absolutely aimed at vets, general practice vets, and other pet care professionals, vet nurses, non-veterinary behaviorists, dog trainers, dog walkers, and so on and so forth, just to start getting some education out there and breaking down some of the maybe misconceptions, or not taboos, but just some of the kind of question marks I think that exist around psychopharmaceutical medications. So both of those links are going to be in your show notes. And like I say, the PDF is just really handy to have, easy to reach, just to kind of read through it to see if there's anything else that you've perhaps missed, or that you can do if you're struggling to administer medications to your pets. So I hope you found this episode useful, and I really look forward to seeing you in the next episode, which will be next week, and that will be episode 75, and I will see you there. Bye for now.